My name is Ronnie Fass. I am a professor of medicine at Case Western Reserve University, and I'm also the division director of gastroenterology and hepatology at MetroHealth Medical Center in Cleveland, Ohio. So today I gave a lecture on the topic esophageal motility for clinical practice at the Allied Health Clinical Practice Conference. And I had the pleasure to share the podium with Dr. Gary Falk, who talked about Barrett's esophagus. My focus was trying to give basic points on why we do esophageal manometry, and then try also to show the different esophageal motor disorders that we have today based on the Chicago classification. And then go through the potential therapeutic options that we have for each disorder. I started with evaluating the role of motility in the GI tract, because I do feel that if you want to understand esophageal motility, you need to understand what is the purpose of motility in the GI tract. Then we moved and we focused on esophageal motility itself, the physiology of it, and then how we can assess esophageal motility using esophageal manometry, focusing primarily on the important metrics that help us to determine the presence or absence of esophageal motor disorders, looking at supportive tests, for example, like time barium esophagram, EndoFLIP, as well as others. And then look at the different esophageal motor disorders that have been described. I finished my presentation with a very nice case of a young woman who presented with dysphagia and had symptoms of emesis that she described during food consumption. And I was able to show that by using esophageal manometry, one can actually recreate what the patient was experiencing during food consumption. At the end, we answered some questions. The questions really focused on the role of EndoFLIP today in evaluating esophageal motor disorders, and especially integrating EndoFLIP into the current esophageal manometry, and as well as other diagnostic tests that evaluate esophageal motility. Thank you.